Hi, I'm Christian Brindle, and welcome to the Everything Medicare Podcast.
What's up, Everything Medicare Podcast Nation? This is Christian Brindle, wherever you are and however you might be listening to us today. Thank you so much for taking the time. And this is episode 160. We're really getting closer and closer to 200 episodes. If this is your first time tuning in, my name is Christian Brindle. I'm a Medicare health plan expert and specialist. I'm a licensed insurance broker. I own an insurance agency called Christian Brindle Insurance Services. We specialize in Medicare health plans. And every single week we bring you 3 podcast episodes where I discuss your Medicare, your Medicaid, your Social Security, and everything that has to do with that golden age called retirement. My voice is getting closer and closer to being back to normal. I hope I sound better, more clear today, maybe a little bit less raspy than I did on Monday's episode and Saturday's episodes. And folks, we have our first shipment in office of the new book, The Insurance Funnel. And I'm so excited about this book. If you're watching us on YouTube, you can see I'm holding up this stack of copies of the new book, The Insurance Funnel. The Insurance Funnel 9 simple tests every insurance policy must pass before purchase. If this is your first time tuning in, I've published 3 books on the topic of insurance. The first 2 are about Medicare specifically. The third one, The Insurance Funnel, is about just basically any insurance policy to kind of help you determine if it's a good buy for you or not. If it's a good deal. I mean, this is something that's a need, folks, and I knew that. And so I constructed a formula that's foolproof. If you haven't picked up the Insurance Funnel already, head over to Amazon, type in Christian Brindle, pick it up. Today, folks, I'm going to be talking about Part D prescription drug plans, a topic we've talked about a lot on this show before, but I thought this would be an interesting little discussion for anybody that might be new to the show. But also, even if you're not new to the show, I think we can bring some value to you because in the Medicare world, there are a few things that people look at as sort of a downside as far as coverage is concerned. I would make the argument that in most cases, especially for people that take a significant amount of medications, the drug coverage is one that is primarily difficult for people because of the stages of drug coverage we've talked about before. You have the deductible stages. Then you have the initial drug coverage stages where you just pay a copay. Then you have the coverage gap stage, which used to be referred to as the donut hole stage, which basically means once the total cost of your medications have reached a certain amount, what you end up paying goes up as far as percentage based. You end up paying 25% in 2020 of any medication. And then you have the last stage, which is catastrophic coverage, which is basically when your coverage is better than it ever was. But that being said, you have to pay out an arm and a leg to get there. And we've done episodes in the past about, different kind of strategies that we've came up with over the years. And we've advised our clients as far as what they can do to kind of help maintain these costs, control them and lower them. But it's one of those things that is frequently difficult for people because the Medicare system, and this isn't just standalone Part D drug plans, this is on Medicare Advantage plans, whatever, drug coverage is difficult for people. It really is because it's not designed to help you win. The drug coverage isn't as good as it would be typically on, an employer plan, a federal plan, maybe even a marketplace Obamacare plan, depending on the prescriptions you're taking. Medicare plans have a lot of advantages, a lot of good things about them. Typically, the premiums aren't so high. In most cases, you can usually get very, very good coverage for very little premiums. Whether it's a Medicare supplement or a Medicare Advantage plan, you can usually get away with it, having excellent coverage in the event of a Medicare supplement and pay very, very little out of pocket. Medicare Advantage plans, you can still get very good coverage and end up walking away without paying a whole bunch of premiums, But the prescription coverage is the one that's tough. And there are some things that we see year in and year out that make the drug plans incredibly difficult. And those are provisions that the insurance companies put on their formularies that make it difficult for people to get their medications. And, something might be covered on the formulary, but there might be some kind of exclusion involved that could make it a little tricky for you. That could make you jump through some hoops in a sense. And in some cases could stop you from even getting your medication, even if it is in the formulary. And there are things that people need to be aware of. And it's something that you need to be present of mind about in order to make a good decision when you're picking out a prescription drug plan. These are things you need to watch for. And it's something that I wanted to talk about on today's episode, folks. I'm not a big fan of surprises. I never have been. I don't like surprise parties, and I don't particularly like surprises when I'm buying something. Neither should you, especially when you're buying something. Now, I'm not saying you shouldn't like surprise parties. That's your prerogative. But the point I'm trying to make is I don't necessarily like surprises. And if you're not looking at the details, when you're picking out a Medicare Part D prescription drug plan or even a Medicare Advantage plan with drug coverage, you could potentially run into some surprises that could be utterly painful to you financially, if nothing else, the time and headaches that it costs to get through those hoops that they make you jump through. We are in a day and age where we're in the information age, that information is more accessible than ever. Most of us have smartphones. I take it if you're listening to this podcast, you probably have some kind of smartphone. A lot of you might even be listening to me right now on a smartphone. We can typically look up anything on Google, YouTube, various different places on the internet and find some kind of information and answer. And it's not always going to be good information, but it's going to be information. And there seems to be very, very little information, at least quality information, I'd say, out there about Medicare. Medicare is one of those things that, yes, there's information out there, and there's more and more information being put out there than ever because of people like us, people like, that are putting out informational materials, whether it be on videos, podcasts, articles, whatever the case might be. It's becoming more and more accessible, but it's still something where the information is not out there enough. And far too often are people on Medicare stuck with surprises, especially on the prescription drug plan side of things. We've done episodes about the donut hole, well, not to call it the donut hole anymore, the coverage gap. I'm not going to be talking about that today. That's not what this episode's about. What this episode's about is different provisions, like I mentioned, that your drug plan could potentially have on typically brand name prescriptions, tiers 3, tier 4, tier 5 even, that you need to know about before you sign up for it. I have to take a quick break. Don't go anywhere. I'll be right back. When I come back, I'll tell you exactly what it is I'm talking about. Welcome back, everybody. Thanks so much for sticking with me through that break. Before I start off segment 2, I had a quick announcement I wanted to make about the insurance funnel of the book. I'm going to be doing a giveaway, okay, in the month of March. And the giveaway is going to be as follows. We're going to talk about it on every episode until March ends. I will personally mail you a autographed copy of the insurance funnel. No charge, completely free, no strings attached, to the first 3 people that leave us a 5-star review and say something nice about the show that they've enjoyed on either Apple Podcast, you can also do this on iTunes, and or Stitcher Podcasts. That's all I'm asking. Now, in order to prove to me that you're the one that left this review, I would need you to take a picture of it with your phone or something else. And if you're not sure how to do that, I'd ask, your kids or somebody to help you with it. It's very simple once you know what you're doing. But take a picture of it for proof and email it to me at christianb@xmission.com. CHRISTIAN, B as in boy, at xmission.com. christianb@xmission.com. The first 3 people to do this will get a free autographed copy of the insurance funnel from me personally. I will mail it to you, but you also need to let me know your name so I know who to sign it off to, the book, and to your a good mailing address so I can send the book to you. I'll never send you anything again. I will not bother you. I will not bug you. It's not a trick to try to get your email. We just simply want to reach more people just like you who need to hear this information. So if you'd like a free copy of the insurance funnel, it's typically $15 on Amazon. I'm charging a little bit more for this book because I think it's that valuable. In fact, I think we could probably charge $30 for it, but I'm not greedy. We charge $15. But if you'd like a free copy, the first 3 people to do that for me, I will send you a free autographed copy of the insurance funnel. Okay. 9 simple tests every insurance policy must pass before purchase. So just wanted to let that be known and get that out of the way. This is starting now, going until the end of March. First 3 people. If you're the 4th person, we won't be doing it for you. It's only for the first 3 people. So make sure you do it quickly and beat out everybody else because this is a big audience and I guarantee you 3 people will do it very, very quickly. Okay. Now let's get back into the topic at hand. Part D prescription drug plans. What are some things that you need to watch out for? Well, in the Medicare world, insurance companies have 3 things in particular, typically, that a prescription can be in the formulary, but it can have one of these 3 things attached to it that make it so they don't have to fill your prescription needs right away. The first one is quantity limit. What a quantity limit is let's say you take a medication, but let's say your doctor has advised that you need a higher dosage than normal of that particular medication. Let's say you have a condition that the medication is treating or maybe maintaining, and the doctor just says you need a higher dosage than normal. Well, insurance companies can put in their formularies. Remember, these formularies are thousands of medications. They can put in these formularies quantity limits that basically maintain the most commonly used dosage, and they won't pay for anything more other than that. Now, it's not to say that this is permanent. What the insurance company typically requires of you is that you have your prescribing doctor send in documentation to the insurance company to basically explain why the doctor thinks that it's medically necessary for you to have that increased dosage. And typically, if they get that, they will waive the quantity limit. However, this is not done overnight. I see people all the time sign up for a plan. It starts the 1st of any given month. They go to the pharmacy on the 4th to get their medication. Pharmacy can't fill it. The insurance company denies it because they haven't got this quantity limit. People don't know. They panic. They freak out. They call their agent. They call the insurance company. They hear this news. They then call their doctor, and it takes their doctor a week or 2 to get it done. Doctors' offices are busy, and they're not exactly incredibly proactive on getting these things done quickly. Some doctors' offices are, but a majority are not. You could be in a situation where you go 2 weeks, sometimes longer, without the medication that you need. And for some people, that could be dire. Quantity limit. Make sure you're looking for that when you're checking your medications or you have someone checking your medications. Don't be afraid to ask, do any of my medications have a quantity limit? It can be a big headache if you're not looking for it. But if you're prepared for it, the doctor's office can send it in before the plan even takes effect, or maybe the day it takes effect. You should be able to get your medication very quickly. There's no guarantee that they will approve it, but typically, if they get the thumbs up from the doctor's office or the prescribing physician, it's usually not an issue. So that's number 1, quantity limit. Number 2 is step therapy. A lot of you are familiar with step therapy. What step therapy is they might have another medication in their formulary. Maybe it's a brand name that you take and there's another prescription that's similar, that's a generic, the insurance company says, we would rather you try this cheaper medication first before we're willing to pay for the brand name that you need. Now, in a lot of cases, if you're taking an expensive medication and there is a cheaper alternative, a lot of times your doctor has usually started you out on the cheaper medication. In a lot of cases, so you've already tried this before and maybe it didn't work, and then the doctor transitioned into the more expensive medication and that one does work. The insurance company doesn't know that. So the insurance company needs documentation of that. Step therapy. Step therapy is something that's been terrorizing people in the insurance industry for years. Watch out for step therapy. The third one is prior authorization. Prior authorization simply means that they will not, they'll cover the drug. It's in their formulary, but they will not let you fill it until they get medical records from your doctor determining why it's medically necessary. Prior authorization. All three of these things can be fixed by your doctor sending in the proper documentation in a timely manner, but it doesn't take the insurance company. It's not like to say that the insurance company in one day or necessarily overnight can process these. Insurance companies are big, faceless corporations. This information goes in and it needs to kind of go through the machine a little bit. Watch for these things. You want to make sure that you're either avoiding them, or if let's say the best plan for you has one of these three things, you need to be prepared for it and get the documentation sent in before your plan takes effect. So that way you don't run into it when you need to get the medication filled. So let's review. Quantity limit is when your doctor prescribes a medication that's higher dosage than it normally would be. Quantity limit. Step therapy. They want you to try a cheaper alternative medication before they're willing to pay for the medication that you might need. And 3, prior authorization. They're not willing to pay for it until they get medical documentation from the doctor that states why the doctor believes that it's medically necessary for you to be on that medication. Very, very important, folks. Make sure you're watching out for these 3 things if you're picking up prescription drug coverage in any facet if you're on Medicare, because they do exist. They're alive and well on Medicare Advantage plan formularies and also Part D prescription drug plan formulas that go with Medicare supplements. Hope you folks enjoyed this video and also this podcast episode. If you did, like I said, please do us a favor. Leave us a 5-star review on Apple or Stitcher. And if you do so, take a picture of it. Like I said, send it to me in my email, and I'll send you a free copy of the Insurance Funnel autographed by me if you're with one of the first 3 people to do it from the time I make this announcement till the end of March. Okay? First 3 people, first come, first serve. Free autograph copy by me specifically. I'll send it to you personally. As always, folks, if you live, we've added some more states to our repertoire. We're still working on California. We're also working on adding the great state of Virginia. But at the moment, the states that we're allowed to do policies for people in are Utah, Idaho, Colorado, Oregon, Texas, South Carolina, and Florida. Again, that's Utah, Idaho, Colorado, Oregon, Texas, South Carolina, and Florida. If you live in one of those 7 states, and also Virginia and California, we'll be all wrapped up and ready to go in those states very soon. But if you live in one of those 7 states that I mentioned earlier, and you're just not happy with your Medicare plan, or maybe you're turning 65 and you just don't know which way to go, or whatever your situation might be, if you'd like us to review your situation for no charge, we work with all of the largest insurance companies available in the industry. Give my office a call. Let's talk personally. I'd love the opportunity to be able to work with you. Our office number is 801-255-5340, 801-255-5340. That's Christian Brindle Insurance Services. Ask for me, Christian. I'd love to talk with you. At the very least, if you're already on Medicare and you already have a plan, and if it's the best thing for you, we'll tell you, and you can sleep better at night knowing that you're taken care of. Take care, folks. Thanks so much for taking the time. Thanks so much for listening. And we'll be back with you with another episode on Saturday. Take care.